Okay, let's talk about our patient today. Our patient today is a dentist. Young lady, a preeminent lecturer, a dental hygienist from Bulgaria, Buffalo, New York, Atlanta, Oklahoma, Vancouver, Canada, Boston, Kansas City, San Francisco, Montreal, Munich, Germany, London, and Santa Maria, California. And we're going to place 14 Lumineers, 8 Lumineers, 10 Lumineers, 6 Lumineers, 10, 2, 8, 8, 10, 10, 8, 10, 8 Lumineers today on our patient. And now we're not treating teeth anymore. We're treating smiles. Isn't that beautiful? So let's look at the transformation from where we started and where we are. Our patient today is an example of that. Okay, so before you get started with your first case of Lumineers, you want to be prepared. You need to start out with a great assistant. So this is Lisa, and Lisa just got her Lumineers about 4 weeks ago. But you'll see as we're going along, everything just flows, and you want to be prepared ahead of time. If you want to get your staff trained, get some DVDs, look at them together, go through the whole process, and have your key assistant tell you all the things you need to do. And the best way to do it is look at it not once, but 2 or 3 times before you do your first Lumineer setup. It's very simple if you do it right. And let's take a look at what Lisa's got here on the tray. Looks like a lot of things, but it's like a surgeon. If you look at all the instruments they have, they really just go into groups of things based upon different functions. So Lisa has this prepared, and on this little piece of white paper here, Lisa has placed all of her Lumineers and treated them with the Cerinate Prime and the Porcelain Conditioner. And the Cerinate Prime is a silane. One of the things that's important is we want to put the silane on and hydrolyze it just before, an hour or so, but in that neighborhood, before you go to put it on the tooth. You don't want to do it days and weeks before. And so the reason you have to put the porcelain conditioner on, it's an organic acid, citric acid, and that's critical to activating the Cerinate Prime. So when you get the Cerinate Prime, it's the most reactive, it's the strongest, and it's one of the reasons why these restorations last for 20 years without popping off. But it's all about surface preparation. Now, once you've got the surface prepared, then it's a matter of putting the material between the porcelain and that prepared surface. I'm wearing 4-power magnification. Now, when I'm using 4-power, visually, I'm this far from the surface of the tooth. I mean, I'm almost sitting on the edge of his lower teeth when I'm finishing. Is that a fair statement? We have one dentist here that uses 4-power. It's such a tremendous assistance. Now, what does that enable me to do? Well, I can do better work. I can do it more precisely. I can do it faster. I don't give patients anesthetic. Why? Because I want to see what I can do without cutting away sensitive tooth structure. Let's talk about something else that's going to make, if this thing goes well and it's simple, it's a Sapphire Light. It's going to take me about 1 minute and 10 seconds to bond those porcelain veneers to his teeth once we get to that stage. So it gives you more power, and you can cure all of your composite resins in about 3 seconds. Another thing that's very important is getting a good impression. We highly recommend the Lumineers impression material because you can get really crisp, sharp margins in there. Any polyvinyl siloxane will work. What I like to recommend is that before you let your patient go home, you pour your first model and wait until it sets. And when you're satisfied with those gingival margins, send your patient home. Because every so often a model comes in and the margins aren't clear, and they call the dentist and say, we could do a better job for you if you had a sharper impression. The other thing you want to look out for is what happens when the Lumineers fit the model and don't fit the teeth. Chances are that impression was taken out too soon. No way you can tell that until when you put it in the mouth. So A distorted impression looks exactly the same as one that's perfect. Leave the impression in for an extra 30 to 60 seconds, more than you think you need to, and it pays big dividends. Lisa has polished his teeth with the Lumineers porcelain polishing paste. I like that because it does a better job of getting rid of plaque than does the pumice when you put it on. Pumice tends just to push it around. Now I'm putting paint on dental dam on the lingual side of his teeth. Every place I put the paint on dental dam, the Ultrabond won't stick to the teeth. And that makes it greatly simplified in the finishing process. Now, one of the things I got to watch out for here is that space between the two front teeth. Close your eyes. Okay, now the best way to protect your eyes is to close them. That's what I do. Place the light, close your eyes, push the button. And what I'm doing is polymerizing the same paint on dental dam that we use for sapphire bleaching, chairside bleaching. And I'll check it just to make sure it's in the rubbery state. It is. And then we'll come back over here. And you'll get a chance to look at this here in just a minute. Okay. Now close your eyes. 3 seconds, about a ½ inch or an inch away. Close your eyes. Okay, let's see if this set. Okay, hold on. Now let everybody take a look at this. Greatly simplifies the whole process. Now the next thing we're going to do is begin surface preparation. And I'm going to use Etch N Seal. Now why Etch N Seal? Etch N Seal because it's 30% phosphoric acid and it contains aluminum oxalate. And I put a little dab, I use a medium viscosity on the tooth so it doesn't run all over. And then I push it around. I have control. And if I was doing an operative procedure where I had exposed dentin and I was etching the margins, then the aluminum oxalate would seal the dental tubules. What we're going to do is apply some of the inventions of Ray Bowen, a composite. And not too many people know, maybe you don't even know who Ray Bowen is, but he also is responsible for tenure. And it's never been surpassed by any other bonding system. And what really makes it nice is it bonds to any composite system you're using, whether or not it's light cured or self-cured. And it even enhances bonds to enamel tremendously. So I use Tenure AB. Okay, now we're going to try in 2 teeth. So let's take the right central and the left central. Now that shade is not the shade of the Lumineer. That's the shade that you get back from the edge surface on the lingual side. There's a thing called the index of refraction. And when you go through a medium, if you don't exceed the index of refraction, light continues. If you have a break in the index of refraction, such as from air to water or air to porcelain, then what happens is you get a reflection back from the etched surface, not from the surface that you're going to bond to. Now, when we put the try-in paste in, we now get a correct appearance of what this will look like. Okay? Look at the difference between the right central and the left central when they're the same shade, except it doesn't have the try-in paste in there. Okay, now we're going to take the right central off, and we're going to put, what, B0 or white on there? Now, the nice thing about the Ultrabond try-in paste is it's exactly the same formula as the Ultrabond. And somebody did a little study on that, and that was one of the things they said they really liked, was that the try-in paste matched exactly the color of the Ultrabond. And you don't have to remove it. You don't want to wash it out or clean it out. We'll show you how to do that in a moment. Now you're going to get a chance to tell me what shade you prefer. Do you like the tooth on the left better or the tooth on the right better? Tooth on the right. Okay. So we're going to go with the Ultrabond white. Okay. Okay. And what I'm doing is taking Tenure S and wiping off the tri-end paste. And I want to be sure that I get it all off. And I also want to be sure that we don't dilly-dally at this stage of the game, because the Tenure S will make the tri-end paste set. So Lisa gets the tri-end paste out of the Lumineers with Tenure S, most of it. What she doesn't get out isn't critical. And the reason is that the Tenure S will cause the tri-end resin to polymerize. Once you've treated the surface, a race begins between contamination and resin. Whoever gets there first wins. Now you're wondering why I didn't try all these veneers on. I did try them on earlier just to see if they were going to be the right shape. Left? Left central. Lisa always calls out the name of the tooth for me, and I repeat it. Okay, left, right central. Right lateral. Okay. Pardon? I think we'll do the right cuspid too right now. The reason I usually don't like to do a lot of tri-end with patients with the resin is that the interproximal embrasures never look as good as they're going to look when you finish them. If you ever see a case of Lumineers where you don't think they have good anatomy, it's because they weren't finished right. And we'll show you how to do that. And then I'll do the left cuspid. And then we'll use a 2mm tip to get these fixed in place before I slip over to the left bicuspids. And this is the left cuspid. Okay, now what I'm going to do is take the 2mm sapphire tip and put it on the tooth and gently hold it and close your eyes. Okay. When I place it, I don't put a lot of force on this. I gently place it, but I want to see excess ooze out from the margins. And I'm holding the incisal edge and make sure I got where I want it, and I'm just putting it on the labial. Okay. Now notice I put 6 teeth on there, but I only spot cured 4. In other words, I didn't spot cure the cuspid. And I always stay 1 tooth, most distal, from the last tooth that I placed, because I don't want to accidentally cure the distal margins, because then I'd have some extra material to remove. And that's the reason I don't like to do them 1 at a time or 2 at a time, because sometimes that distal margin, as you place it, leaves excess, and it takes a lot of time to clean that up. And sometimes it gets in the way of seating the composite, the veneer. So now I take the 2mm tip, and now I go to the cuspid. And close your eyes. And so I like to have backup systems in place. I never make mistakes, but when I do, it's kind of nice to have a little fail-safe mechanism in there. But you never want to have Tenure S on the teeth when you put the tri-end paste on. And close tight. Close your eyes. What I like to do is I always like to wipe the Ultrabond from the gingival toward the incisal and make sure that it fills the space between the porcelain and the tooth. And I'll wipe a lot of this off here right now. Now I'm going to take the sapphire tip, the 9mm tip, and put it on each tooth. Close your eyes. Five seconds a tooth. Close your eyes. Close your eyes. Okay, let's take a look here now and give me a mouse mirror. And we'll just check the areas. Okay, we got a little bit more in here. Take that off. I always like to check around the margins to make sure that it's all set. You know, if you think about what I just did is I bonded like what, 10 teeth in about, or polymerized it with the light in about a minute. Let's show them that. That looks kind of nice, showing how the ultra bond is on there. See that combination? Wherever that paint on dental dam is, it doesn't stick to the teeth. And we want to use a blue shade for obvious reasons, because you wouldn't want to put a tooth-colored paint on dental dam. See how those gingival margins are all nice and crisp now? That's going to save me a lot of time in finishing. Now I'm going to go in and get this stuff off, and I'm using a 12 fluted burr. And what I'm taking off is the ultra bond, and I stay away from the glazed surface of the porcelain. Now the reason I like to get the ultra bond out of there is when I come back in with the diamond, I'll be able to be sure that what I'm touching is porcelain. Because if you have the ultra bond masking it, then you might ditch it a little bit too much or something like that. So you just go through and you just take off that ultra bond and stay away from the glazed labial surface of the porcelain. And the key to this whole thing is take the time in the finishing, because it's the finishing that makes these things come to life, or the lack of it. By the way, something I should tell you that I haven't told you, but you don't have to take it all out of the Lumineer, because if you wash everything off and then you apply it, you're talking about a lot of time, and I don't have any objections to taking more time, because I probably take a little more time finishing than I do in placing. People say, well, don't you ever put dental floss through there, and don't you do a lot of these things? And I say, well, this is a technique that I follow, and I'm not trying to tell you it's the only technique. And but let's take a quick look here. Put your head down. But this is about what they look like on a try-in, and they don't all look this good on try-in. And he doesn't look as good as he's going to look after I finish and open those embrasures with the needle nose diamond and that sort of thing. But once you start doing a try-in and the embrasures aren't quite right and all that, all of a sudden you and the patient are looking for what's wrong. Now sometimes when you try these in, if they don't seat all the way, I have found that if there's a little chip on the model on the incisal edges, that the porcelain won't seat all the way. So I'll go back with an ultrafine diamond and I'll remove some enamel to see if it'll slip down. But I try not to adjust the porcelain, much if at all, when it's out of the mouth before it's bonded. You see, this is called a Schure 349. See what I'm scraping? This will never scratch glazed porcelain. Don't ever use a hygienist instrument, because it will scratch glazed porcelain all the time. So this is so critical in this procedure, and I'm so glad I remembered to tell you that. So what I'm doing around here right now is going on tooth by tooth and making sure that I've got a good blend and almost all the ultra bond off. Can you get that? There we go. Now I'm going to use a needle nose diamond. This is what I'm going to go to get rid of the shoulder. Now there's a couple of questions you have. Well, if you get rid of that shoulder, you got rid of the glaze, right? Well, the part that I'm getting rid of is like a stealth airplane. It gets reflected back into the mucal buccal fold. It doesn't get reflected back to the eyes of the viewer. And I'm just taking out now the porcelain and the ultra bond and blending it with the surface of the tooth. And that's the way I do my enamelplasties. I just keep taking away what I would like to take away, and if I would like to take away more and it's sensitive, Then I give it to the technician and say, show me what you can do without my having to come away more tooth structure for you. So I'm going at about a 60-degree or a 45-degree angle to the gingiva. See that? How it opens the embrasure? And I'm just going in these interproximal embrasures with this fine, ultrafine diamond. And all of these instruments are in the clinician's finishing kit. Now, the thing that's important here is to take your time getting the ultrabond out with magnification, because it'll greatly simplify opening the embrasures. Now we're going to talk about occlusion here in just a minute. And this is a Ceri saw. So, now if I had a lot of ultrabond in those embrasures and I start trying to open it before I had the ultrabond away, then I'd have a lot of work doing this. I rock it. Don't saw all the way through. If you run into resistance, stop there and start rocking your saw. That's the thing to do. Just rock it like that. And you have a lot of, this is the most pressure I use on the patient. And I don't always open all the contacts. So what isn't open today can be opened tomorrow. Now we'll take the Cerisander. So we take the Cerisander, which is nothing more than what orthodontists use to open embrasures on contacts so they can get their bands in there. I don't know if you can hear this, but this is just smoothing up those rough edges, because just because you open the contact doesn't mean it was smooth when you run floss through it. Now where we have that space on those interproximals, we don't want to open that embrasure too much, or otherwise it won't look so nice. So you got nice tight contacts, and that's the reason why I don't like to put things in between, because you couldn't get a better contact than that. Now let's talk about occlusion. Open. First 3 steps. Surface preparation, bonding to the surface. Now this is what you got to look out for, because if you don't have the occlusion established, oh, this is good. So you blow that off. Here's what you got to look out for. You see this blue on the cuspid and on the bicuspid and on the distal of that lateral. If you leave the patient go that way and they do much bruxing, that's going to get chipped and broken and knocked off. And let's take a look over here on the right side. That bicuspid. These are places that are just waiting to cause all kinds of trouble for you. So while I make everything seem simple and easy, it is if you do a correct occlusal adjustment with a correct occlusal equilibration. Open, close, open, do it again, grind around, forward and back, all over, sideways, all the way back, all the way forward, open. Now let's see what we've got here. Well, it's getting better, but we still got some marks there. Let's take a look. There's a distal of the lateral. A lot of these will break off with that mandibular cuspid. Let's see what these lower teeth look like. Oh, look at that cuspid tip. That sucker says I'm out looking for distal of laterals. I don't know if you can see that lower cuspid right here, but this is a very pointed tooth. And this is a lateral, distal of the laterals. It likes to knock them off. So I'm going to take a little off the adjacent teeth. Once again, if I do anything that you feel or anything uncomfortable, raise your left hand. Remember, I'm using ultrafine diamonds, and I'm using high-speed water spray, and I'm using a light feather touch. You never want to work on porcelain dry, because you might get too much heat and you might cause some fracturing of the porcelain. Look at that mandibular cuspid right there. So you want to get those tips off there, because when they go into protrusive, they knock off the distal of laterals. Close, grind around, forward and back. Now some of the other things I want to do here, just a little bit, although in his case not very much, but I want to take and get the distal incisal of these laterals, and I want to show you how you can contour them afterwards if you want to change the anatomy. So now I'm going to take the distal of the lateral, and I'm going to start making it look like laterals usually do. And I'm going to take a little off the mesial of the cuspid. And I like to have the laterals just a little shorter so they look more like individual teeth. No anesthesia, no screaming pain, no blood running all over the place. But we've got the occlusion. Now we're going to take a look and give him a mirror so he can look at himself. If you don't like them, we'll take them back. All right? Nobody wants to take them back. Now we'll turn sideways, put your teeth together. Okay. He had an open bite when he started. He must have been a tongue thruster when he was younger. But there he is. Now anything that we don't like, when we have the patient back in a week, we can change this. Let's have the hot plate there, and you can show that to them, Lisa. There we go. That's what they look on the lingual. We cleared it up.
Well, I had a diastema, or a gap right in between my front two teeth, and I had some chips and some spacing there. And I also had existing dental work done on one tooth in particular, which was really ugly. Well, the only reason I chose to get Lumineers was because I know that there wasn't any grinding, any removal of sensitive tooth structure to me or anything. I mean, it was just simply straightforward 2 visits. With the Lumineers, it's definitely helped boost my self-esteem. I don't have to cover my mouth anymore when I laugh. And I usually have a big laugh and a big smile, and I was always absolutely afraid to show it. I mean, even just in my professional career, I mean, to fully stand there in confidence it's absolutely something the Lumineers has given me. Lumineers has given me the perfect smile.